How's everybody doing? It's about 11 o'clock now. I'm David Lane, the manager of rehab here at Mason Point for the Care Center Assisted Living, and we also do service to independent living as well. We basically what we're doing is every month we're gonna have a presentation or some sort of we did a fall balance screen recently. I guess it was probably about 6 months ago. We'll be doing that again coming up. Just doing some more interactive things. I've got a list of different things we're gonna do. We did diabetes, we have cardiac. We're gonna do a series on falls based on medications, physical ability, and then also even the environment, like within your apartment or within the facility itself. We have one on urinary incontinence, and so just keep your eyes open. They'll be coming out soon. So we'll go ahead and get started. This topic is living with cardiac conditions, and what we're going to do is we're going to go over some of the most common heart conditions that we see. Also, the kind of how the disease process impacts your cardiovascular performance, and kind of the role of how therapy can help you in this area. Some facts to know about the heart. Your heart is basically the size of your fist. In males, it's 10 to 12 ounces. In females, it's about 8 to 10 ounces. It does beat about 100,000 times per day. And when I kind of did the math, that's about 3 billion times in our lifetime. So quite a few ticks there. Pumps about 6 quarts of blood throughout the body, and obviously everybody knows where your heart is. So one of the things that we have to do, one of the ways to monitor your heart health is through taking your blood pressure. And just recently, I've always remembered 120/80 was ideal where you want to be. But today's data, they actually under 120, so that 119/79 is the ideal range to be in. So they're saying if you're between 120, 129 over 80 or less than 80, then you're somewhat elevated. High blood pressure, stage 1 would be 130 over 139, or I'm sorry, 130 to 139 over 80 to 89. Hypertension stage 2 would be 140 or higher, over 90 or higher. And then if you're in a crisis, you're over 180 and over 180 over 120, you better get to the hospital at that point. Your top number is your systolic, and the bottom number is your diastolic. There's been, over the years, which is more important. I think they're both kind of on an equal playing field now. I guess it all depends on where you're reading, but keeping up with your blood pressure is key. I have to take my blood pressure and document it twice a day just to make sure I'm on track with my meds and with my doctor, and I keep it going as well. Some of the common types of heart disease that we see, angina is basically just chest pain, and that's from the lack of blood getting into the heart. Your arrhythmias, that's going to be just your irregular heartbeats. Atherosclerosis is the hardening of the arteries from plaque, so less blood is getting through. Atrial fibrillation or AFib it's basically an irregular heartbeat where the upper chambers and the lower chambers are not beating in sequence, and so say you should have a thud, lower upper, where with atrial fibrillation a lot of times, like you have two lower ventricles and 2 upper ventricles. One of them are not beating correctly, so it's kind of you've got more of a sputter, I guess you can say, which then in turn causes problems with blood distributing through the body, causes weakness, causes fatigue, shortness of breath, those situations. Cardiomyopathy is an enlarged heart. That's typically more of a congenital thing. you're born with, and it's very difficult with a large heart to get the blood to go throughout the body as well. Then your congenital heart defects, those would just be your abnormalities that you may have at birth. Congestive heart failure is it's a chronic condition where the blood's not being able to flow efficiently through the body. Peripheral artery disease, or PAD. It's a circulatory condition in which how do I say it? Like the blood vessels, they're narrowed, and so it just reduces. Similar to my mind went blank. You're not getting the blood flow to the far extremities of your body, your feet and your hands. Similar to I know you know.
Neuropathy?
Thank you. Okay. Similar to neuropathy. Thank you. Yeah. Pulmonary hypertension is basically the effects of the arteries in the hearts and the lung. And then valvular heart disease is it's when the heart's not beating efficiently, and sometimes the blood will leak back into the heart instead of going out through the body. A lot of stuff there. Anybody have any of these? Yeah, I'm sure we all do, yeah. Complications from heart disease, obviously, we know heart failure, heart attack, stroke, and aneurysm. These are definitely the things we want to try to avoid as much as possible. Some of the risk factors, obviously with age, which isn't fair for us, but sex, family history, if you're a smoker, if you've been having treatment for cancer with chemo or radiation, poor diet, high blood pressure, diabetes, obesity, the lack of physical activity, stress, and even poor hygiene. A lot of that comes from oral care. Oral care. Over the years, I've worked with several people who may have had an abscess or some sort of infection in their mouth, and it traveled down. I've had them where it's traveled down to somebody who may have had a knee replacement, and it infected their hardware that had been there for years. It also goes down. It can affect your cardiac, and it caused heart attacks, things of that nature. So taking care of your teeth is very, very important. I try to tell that to my kids, and I'm not going to have a heart attack. Okay. I'm going to pull your teeth out then. Some signs and symptoms. So obviously chest pain or pressure is most common. Being short of breath. That's because the blood's not being able to flow through all the extremities and get to the muscles as needed. Sweating. Heartburn or indigestion. Upper back pain. A vague feeling of illness or unexplained tiredness. Once again, that has to do with your body's just not getting the blood. So your blood's transporting the oxygen that we breathe in, and if it's not able to get to the extremities all the way, then your muscles are not getting that oxygen-rich blood that it needs. And then nausea, vomiting, and or general middle abdomen discomfort. Some of the medications with the different conditions and their side effects. So for an MI or a myocardial infarction, basically a heart attack, medications you're going to take are beta blockers and ACE inhibitors. The side effects from this is you're going to have fluid retention. It can decrease your blood pressure. It can lower your heart rate. And you can also feel fatigue and lightheaded. You have a dry cough. With the ACE inhibitor, you can have a dry cough, low blood pressure, kidney dysfunction, electrolyte imbalance, GI distress, dizziness, and skin rash. With AFib, you're going to take an anti-coagulation or an anti-arrhythmic. Blood thinners are what you're going to basically take for there. And obviously, if you're taking a blood thinner, bruising or excessive bleeding from a wound, wheezing, cough, chest pain, blood in your mucus, and fever. With congestive heart failure, you're going to take a diuretic, your vasodilators, or your digoxin or digitalis. And some of the side effects with taking your diuretics and vasodilators are you're going to have there could be a disturbance in the rhythm of the heartbeat, low blood pressure again, dehydration, altered potassium levels, orthostatic hypotension, electrolyte depletion, risk of dysrhythmia, and toxicity can cause nausea, vomiting, heart rhythm disturbance, kidney dysfunction, and you can pretty much read the rest. Basically, what happens with you're not getting the proper blood flow, obviously with congestive heart failure, and you'll notice people with, if you have congestive heart failure, you may have swollen legs at the end of the day. It's because your body's not able to absorb that fluid and get it out of your, get it out of your body through your urine, sweat, whatever it may be. So that's why they'll usually put you on a diuretic to kind of help with the fluid to get out. And then for peripheral artery disease, you're going to be taking any type of medication that lowers your cholesterol, your high blood pressure meds, meds to control blood sugar and prevent blood clots. And your symptoms with that, your side effects, I should say, are headache and diarrhea. I'll take those over the others, I guess.
Yeah.
Nutritional considerations. So the cardiac diet emphasizes fruits and vegetables, whole grains, and oily fish. Most fish are oily though, but these foods are very beneficial for your heart. The oily fish foods, fish like salmon, that are high in omega-3 fatty acids, so really, really good for your heart, really good for your cholesterol. This diet also limits processed foods that are high in sugar, salt, and these are all things that will increase your chance for heart disease. Foods to avoid: the ever dreaded red meat, carbohydrates, sugar, sweetened foods, salt, alcohol, and sweetened beverages. So basically, I mean, everything up there you see except for the red meat is all processed food. Your red meats obviously are higher in the bad cholesterol, but there are lean meats you can eat, and that's one of those things you talk with your doctor about.
But they don't mention up there, which is very important, to staying away from fried foods, and that's very difficult here.
Yeah.
It's very difficult anyway. But even the process, it's like it's everywhere you look. It's everywhere. I mean, your kids' lunches, at school, wherever you go out, here, yeah. No, I agree.
Sugar. You need to stay away from sugar.
So cardiac diet meal plan, here's kind of a little idea you can have. So for breakfast, you can try overnight oats topped with flaked almonds and blueberries, served with some low-fat yogurt. Salmon and avocado salad, including green leaves, peppers, red onions, tomatoes, cucumber, and some lemon. For dinner, prepare a vegetarian bean chili. Okay, serve with brown rice and green salad. And then snack options, hummus and carrot sticks, apple slices, spoonful of nut butter, boiled eggs, hot cakes. Has anybody ever done the overnight oats?
That's what I was going to ask you. So why is it that better than the kinds?
I don't know. I would honestly, to me, oatmeal is oatmeal. I think it's just a matter on how you prepare it.
Well, I think it's because when you get up in the morning and you're so tired, you don't have to wait for the oats to cook.
Yeah, that's
It's
right.
there and you're ready to go.
I guess that's it. I mean, when I make my oatmeal, I don't even measure anymore. I just pour in a bowl, add some water, throw it in the microwave, and ready to go.
Yeah.
Oh, you've got instant. That's processed.
No, I use the regular. I put the regular kind in.
Yeah, that's right.
Yeah,
You can.
the
There's
roll,
one that does that.
not the
yeah.
end, but the roll.
The 1 minute.
The bigger oats.
The regular 1 minute.
No, they're not instant. They're
No, I
not
didn't say
instant.
instant, 1 minute.
1 minute, is that what it is? 1 minute?
Yeah, it
Something like
says it
that.
on the
Yeah,
outside.
Yeah.
Uh-huh.
Yeah.
Yeah, but I think you're right. I guess it's just a matter of it's ready for you when you wake up in the morning. I'm gonna try it, see if it's any better. I guess I don't know.
Well, there is a fellow here, Ed Teeter does that. He
Uh-huh.
makes his oatmeal that way overnight, and we're having dinner with him tonight, so I'm gonna ask him why he
There you
does
go.
it.
Ask him.
I have salmon.
Then, so some of your the lifestyle things that you want to do for having a healthy heart. Obviously, you want to exercise regularly. I know there's multiple classes here and options for everyone to get your heart rate up throughout the day. You want to avoid long periods of sitting. Quit smoking. Relieving stress through activities such as yoga or planning grocery shopping and batch cooking. There's where the oats come into play. I wonder. I don't know if you make them. If they're good like for the week. If you make a large batch that way or not.
Well, sometimes I make two. I mean,
Fridge.
it's that today and tomorrow.
Yeah. And then just being mindful of your portion size. That's one thing I've noticed. Here in America, back before, we'll just say before COVID, portion sizes were massive, and then after COVID, I guess when everybody's trying to cut costs, those portion sizes have started to decrease more when you go out to eat. So it's not necessarily too much of a bad thing. So how can therapy play a role in this? Now, a lot of times, most of us, when we see somebody with a cardiac issue, it's usually right after an event happened. If it was a heart attack. Now, I've seen people just for being diagnosed with like AFib and things of that nature. What PT is going to do? PT is obviously going to work on flexibility. They're going to work on strength, your walking, your endurance, bed mobility, and transfers. And with all that, I just stand up and go, or I just get out of bed and go. With all that, as we age, we also know, we start to have arthritis and other things. So there are techniques that we it's just not easy just saying get out of bed. We have different techniques we can teach people how to get out of bed, how to roll, kind of protect your back. The main thing would be over like where it comes over into OT is work simplification and energy conservation. So it's learning these new techniques that'll kind of help you. And honestly, like I've been doing this 25 years, and you can go through all the textbooks and what the textbooks tell you how to do things. But I've learned the majority of what I teach other people from you guys. People who live it on a daily basis, they know how to get through. They know what they're doing, what's going on, and so I always talk with my patients about how they're doing things, what's going on, and I've learned more from them than I ever had from a textbook. So with the work simplification and energy conservation, it's a matter of doing learning to do some things different than how you did before. Sometimes people take it and they go and they're great. Others are like, no, I'm fine. I'll do with what I want. But you'll have the tools from that point. Also with ADLs, being able to work on your ability to get dressed in the morning, be able to make your meals, being able to clean the apartment, whatever it may be. Also with strength and activity tolerance as well. In speech therapy, a lot of times with speech can help if there's an issue with like learning the education. Speech can help with that asset. Not only do they work with swallowing and your ability to talk, but they also work with cognition. If your cognition, as we get older, it starts to slip as well. Or if you're having a cardiac event, a lot of times there's times where you're going to be a little foggy because once again that blood's not being able to get through the body as well. And then respiratory therapy, which I don't think we don't have a respiratory therapist on site, but they're going to check for your lung volume, They're going to do capacity training, which is trying to teach you how to become more efficient with your breathing. We did have a respiratory therapist here probably about 5 years ago, and then there really wasn't a need. And so I think here in the St. Louis area, they got rid of them all. I guess now if you need one, you have to go into the hospital. So some lifestyle recommendations. I like how they put the first thing up there is rest. Rest 30 to 60 minutes twice a day. But that's also, that means you have to be doing something to rest. So you want to make sure you're sleeping 6 to 8 hours nightly. Who gets 6 to 8 hours of sleep here? Awesome, I love it. I've found as I get older, if I do not get 7 hours of sleep, I feel like my body, there's something wrong the next day. I'm off. It's kind of funny. You want to space out your exercise and rest. Wait after meals to exercise. Obviously, want to get your food digested. Avoid weather extremes, so don't go outside when it's 100 degrees or 0 degrees. Avoid vigorous arm and shoulder exercises. And so now this is if you have heart issues, because anytime you do exercises with your hands above your heart rate will increase. So it gets it rapid, and this is one of those things that you would talk with your doctor with us first. So it's more of what they're saying here is if you're doing real heavy, working your shoulders real heavy and lifting weights up over your heart real heavy, that's what they're talking about here. Doing exercises with your arm above your heart and shoulder is one of the best ways to get your heart rate up when you're working out. So keep that in mind. Yeah. Oh, I'm sorry. Avoid lifting heavy weights or objects. You want to avoid tension and practice relaxation. That's the other key. Something I don't feel like we do that well in our society is take care of ourselves in this area. Your doctor give you your target heart rate, and you don't want to exceed that. Take medications as ordered, conserve your energy, and just pay attention to warning signs. I mean, most issues when it comes to cardiac, I think you know before they start. Obviously, if you're to have a heart attack, I mean that can happen like that, and so there's no warning signs. But I know for like atrial fibrillation, I feel like I've gone into AFib about 4 times this year, and I know it, and I feel it right before it comes on, and then it hits, and so I'm aware. I kind of know what to do at that point, and well, there's really nothing I can do at that point, but I'll get a hold of my doctor and just stay on my medications, and then at that point, then I have to monitor my blood pressure and heart rate on a consistent basis.
Got a question?
Yeah.
On exceed target heart rate there, on that, how do you do that? Do you get a Fitbit or something that when you're doing your exercise, you determine what your heart rate is?
I have an Apple Watch. My Apple Watch keeps track of it. A Fitbit will, or we can train you how to use a clock and just manually take it. Now, I will say if you have like arrhythmias, or if you're in AFib where your heartbeat is kind of up all over the place, mm-hmm. It's a little bit harder. I find it's actually harder to take it manually. When I'm in AFib, like I feel like my heart's beating out of my chest. When I check my pulse, it is. I can't feel it. I can't feel it at all. It's very, very light. So that a Fitbit, even if you use some of the equipment downstairs, they have a little section that you hold on to that will read your heart rate as well. Yeah. So what well-being can do for your heart? Here we go, a little jointed exercise class that focus on endurance, strength, and flexibility. Well-being practices like yoga, meditation, or Tai Chi. I don't know, I bet you most of you guys go to the Tai Chi class, because every time I walk down there, there's no room. That's awesome.
That's right.
How do you get, are you guys really getting a really good benefit from that?
Very much so. It's very
Yeah.
calming.
Yes, yes.
It's relaxation. It's amazing.
Yeah, I love the fact that
Clears your
everyone's
mind.
doing that. That is so amazing. That is great. Physical activity can improve your overall ability to get a restful night's sleep. So if you're exercising more, you're going to start to notice that you're able to sleep better as well. Spend time outside, bask in some of the sun, get some of that vitamin D, and enjoy nature. That's one of my key. I have a buddy who's got 300 acres, and I go out there as much as I can. A lot of times I just go out and just walk in the woods. Just love it. Just love walking the woods and just listen to Mother Nature do her thing. Maintain social outlets. Make sure you're still with your friends. Getting your hugs. Hugs are important. Hugs keep us alive. We want to develop hobbies and interests that bring you joy. Do things that you like. This is going to lower your blood pressure. And a daily walk. Daily walk is always good for the mind-body balance and your heart. I like that. And I think this is basically to the end. My company Cimbria. We have a pharmacy division, which I think you guys may know about. Then there's a therapy division, and then they have a well-being division. And so this is more of an ad saying work with your pharmacist, work with your therapist, and doing your exercise as well. So and I believe that is it. Quick and painless. Anybody have any questions?
I don't have a question, but early on one of your slides about chest pain,
Mm-hmm.
That is probably the least predictable.
Least predictive? Yeah.
Most MI, most heart attacks have atypical pain that is pressure, or it might feel like gas, or it goes to your arm or your jaw.
Right.
Not
in the heart itself.
not in the heart itself.
Yeah.
And those are wonderful warning signs.
Right.
Pay attention to those.
So not necessarily just having pain in the chest, but like it did say pain in the abdomen, indigestion. It didn't say anything about pain in the arm, but you're right. Pain down. Is it the right or left arm?
Usually the right.
The right arm. Correct.
But in women, it's more likely not to be chest pain, but to be referred pain.
The referred pain. Okay. You ladies hear that?
Louder.
So he's saying like if a lot of times with women, if you are having like a heart attack or whatever, that you're not going to necessarily feel the pain in your chest. You're going to feel the referred pain more, either like the indigestion or pain down your arm or in your jaw. All right. That's it. That's all I have, everybody.
Thank you.
So I'll see you guys. I'll see you guys in October. I'll see what I have together, and I'll try to. I want to get an interactive one going next, so we can do something together and kind of get everybody involved. So I'll see what I have, and I'll talk with Beth and get it set on the calendar. All right.
Okay.
Thank you.
Thank
All right.
you.
Thank you, guys.